Hi, thank you so much for the opportunity to talk about this program that was sort of a fortunate brainchild of Jude Leahy and I. I'm Sam Byers, work for the Oregon Health Authority, as you know, and my work is a program implementation coordinator strategist for our health systems division. And today I'm just going to do an overview very quick of Prime Plus Peer program that really blends the efforts of recovery peers with the goal of hepatitis C elimination. So Prime Plus stands for Peer Recovery Initiated in Medical Establishments. Part of our mission and our work description is that we are looking for people in long-term recovery that are certified peer recovery specialists. And what we've added to the work is the harm reduction component and the prevention of infectious disease. And for those of you that have worked with recovery peers, you know that a more traditional model has been that substance use disorder is the only issue that they've really worked with or addressed. And typically, although not as much anymore, but to have a peer, you needed a referral pathway, or you sort of had to be ready to receive services or to be contemplating recovery. And Prime Plus in our mission and the work that we do has really pushed that envelope and said, actually, recovery peer work is essential in outreach as it relates to harm reduction, and particularly as it relates to the prevention of infectious disease and in particular hepatitis C. So our Prime Plus peers reach out to people who are at risk of or receiving treatment for an overdose, infection, or other health-related issues that are related to their substance use disorder. They work with people who are at varying stages of change using a harm reduction approach. So that includes somebody who's like, I have no interest in hearing about recovery or treatment. I would like to hear about a safer use. I would like some naloxone. And maybe I want to hear about whether or not I could get screen tested and treated for my hepatitis C or other infectious disease. And then they really support these individuals in their recovery journey to reach what is their self-identified goals for health, well-being, and a quality of life that they're seeking. Brief background to how Prime Plus came about. In 2018, there was a legislative session that produced House Bill 4143. And 4143 essentially said, we would like to place recovery peers in emergency room departments to respond to people who had a non-fatal overdose. And our legislature actually identified the 4 counties where that would happen. It was Multnomah, Marion, Jackson, and Coos. Your work was really based on some of the work that had happened in Rhode Island with Anchor ED that had a similar model. And so we obviously followed that. And at the same time, we were receiving SOR funding, or state opioid response funding. As an agency, as an entity, we were like, you know, having recovery peers available in a medical setting is probably going to be a good thing. So let's set aside some money so that we can expand this pilot, or at least enhance the pilot sites. We weren't quite sure what we were going to do. So we did expand it. We definitely had struggles getting peers into our emergency room department. So we said, look, serve anybody in any medical setting. You know, really look at people that are leaving county jails or anybody at risk of overdose. And that happened in 14 counties. Alongside this work, Jude in particular was really connected to the Oregon Hope project that really utilized recovery peers in syringe services within the community, connected to OHSU, and was in 5 counties. At the same time, there was a lot of interest at the Oregon Health Authority about how to utilize peers in really responding to everything, right? Like overdoses, infectious disease, you know, safer use. And Jude and I found each other in a meeting where everybody really wanted a peer to do something. And, you know, both of us were, I think, sitting on the same side of, you know, really this is about preventing overdose, and forcing people into treatment is not necessarily the prevention of overdose or infectious disease. And she looked at me and said, aren't we just trying to keep people alive? And I said, yeah, we should talk. And so we combined our knowledge, we combined our projects and our money. and created what is now called Prime Plus. And we utilized Comagine Health. I know on this slide it says provides support for implementation and evaluation, but really Comagine, Jude and I are really triplets in this work, and each are equal partners in how we approach and design the project. So Prime Plus sites, you can see now we have more than 50 peers. We're in 22 counties. 18 organizations are responding in those 22 counties. We basically broken down our work into 3 regions that really align with our emergency response regions, knowing just from lessons around the varying stages of COVID, whether you're extreme risk, high risk, each region has to respond differently. And the wildfires taught us that as well. So we've grouped our peers that way so that if there's a larger issue within that region, we can adjust our work. One of the things that we often don't talk about as program coordinators, I include myself, and that really Prime Plus brought to the forefront, is that our peers doing the work have to be as important, and in fact more important than the work itself. Once you're putting recovery peers into a harm reduction modality where they are potentially seeing people using around syringes, are working with people who may not be thinking about recovery yet, but do want the support, their safety, their knowledge, their skill set are vital. And so you can see here that we provide a lot of trainings. We do a lot of learning collaboratives. We do a lot of support for the peers. We also support the supervisors in terms of how to provide good supervision that takes into account not only the peers' day-to-day work and numbers, but how they do their own self-care, ensure space for their recovery so that they continue to do the work. So Prime Plus services, linkages to substance use treatment and recovery supports, linkages to physical health care, support for infectious disease. We've spent a lot of time obviously focusing on hepatitis C, but of course support anybody receiving screening, testing, and treatment for any infectious disease or any other medical service. We ensure that they have access to community resources for their basic needs. So thinking about food boxes, shelters, housing, transportation, support for signing up for health insurance, of course, OHP, absolutely access to harm reduction supplies like safer use kits and naloxone. And then I think probably one of the number one thing our Prime Plus peers do is emotional and crisis support. That's probably true for all peers in behavioral health, but working just day to day with people who are houseless, maybe ambivalent about their use, it definitely has risen to the top as one of their primary responsibilities. Our community partners make referrals, and before you can see the list of referrals, one thing I do want to emphasize is that Prime Plus is a low barrier peer service. So what that means is there are referral sources into Prime Plus, but an individual does not have to have a referral to receive a peer. And that's one of our values, that, if you're thinking about treatment, if you're thinking about recovery, if you're thinking about your health, if you realize you have maybe a wound that needs to be looked at, if you're ambivalent about your use, but you know that you probably need some information on how to use safely or how to prevent an overdose, or you want to have naloxone, all of those things get you a peer, and that's of importance. It's relatively new. Many of our counties and communities, you have to have a referral for a peer. That is not the case. We're actually supporting this program with funding so that they don't have to worry about being attached to a billable hour or a funding source to do the outreach. And then as you can see here, individuals can self-refer and peers do direct community outreach to engage individuals. So Prime Plus in action, we're always very proud of this. This is, you can see in our Eastern Oregon County, our frontier county of Malheur, and they created Walkthrough Wednesday, where they set up their own syringe exchange and really started to connect with people around access to screening, testing, and treatment for Hep C, recovery, and other services that they might want. The impact of Prime Plus. So we are using Recovery Link. It is a database that was designed out of a team in Chicago, really focused on capturing the work that recovery peers do, and also trying to collect information to reflect the impact of their work. So we just recently introduced this platform, and we're starting to get dashboards out to get a sense of the work and how it's happening. And as you can see in the first 3 months, and to be totally honest, people really got more into Recovery Link in March, but we had 50 peers deployed and they reached 266 participants. You can see where the sources are coming from, and it's all over, which is exactly what we want. Anyone that is seeking the help can get the help. One of the things that we just wanted to start looking at is the activities that are completed between Prime Plus peer and the peer they're supporting. This just gives a visual and a list of things that we have identified as common activities that a peer would do with someone they're supporting. And we're just starting to look at, where is that work focused? Eventually, we'll be able to look at over time, both on the individual's profile as well as a program overall, like an average amount of time they serve somebody, what types of services they often do, and what those services and that amount of time leads to. So hopefully it's safer use, reduction in overdoses, connection to care for their Hep C and other health needs, and then into treatment and long-term recovery. Ongoing data collection that we do obviously is demographic information, referral sources and intake assessments, self-reports about overdose, their quality of life, recovery support attendance. This is federally funded, so we do have GPRAs, that's the Government Performance and Reporting Act that's required by SAMHSA. We do want an intake in 6 months. It is an abbreviated version for peers, but GPRA nonetheless. And then one thing that Recovery Link offers us is a way to calculate someone's recovery capital at intake and then at later points. So all those services you saw in the last slide, how they come together and create recovery capital for an individual so that they continue to move forward in their successes. We do look at encounter data, the types of activities, transportation, appointment supports, referrals provided, testing and treatment for hepatitis C. And then we continue to provide training and support in order to, really gather a comprehensive picture of the people we're serving, and also support our peers and organizations that have not really had to do data collection or work with a database in a way that we're asking them to do so. So that is the overview of Prime Plus. I appreciate you taking the time to listen. I'm going to hand this off to my colleague, Jude Leahy, who is going to facilitate a roundtable with whom we actually believe are the experts on this work, and that's our Prime Plus peers. Thank you again. Jude, go ahead, take it away.